So the multidisciplinary team's role in heart failure management is quite complex and important because it pulls the whole thing together. The key thing about the multidisciplinary team is that all the members communicate well and get on well. They all recognise the core signs and features of heart failure and can adapt accordingly. My usual practice role with dealing with these multidisciplinary teams is that I'll be initially make the diagnosis, convey the diagnosis to the patient, and the very next person they'll see, hopefully the same day, will be the heart failure nurse, who will educate the patient on the basics of their heart failure. The heart failure nurse practitioner, we've put into space, is a valuable tool for up titration of therapies. As you probably all know, most doctors are not good at following algorithms and get distracted by other issues, but nurse practitioners in particular are very good at rigorously ensuring patients are up titrated to the maximum doses and the most effective doses of the heart failure therapy. They're also exceptionally good at recognising signs of decompensation and can seek the backup of their heart failure specialist to adapt things according to the decompensation of the patient. The exercise physiologists and physiotherapists who are involved in these multidisciplinary teams are also good at recognising it. And they should be seeing the patients on a weekly basis at least to provide the exercise program which is going to improve the patient's quality of life. And if they recognise the symptoms of deterioration, they can then escalate that back to the heart failure specialist. The exercise programs in heart failure are important. They're actually different to the other common exercise models, which is that of the acute coronary syndrome patients, which is a very quick, abbreviated program with a focus on rapid recovery. Heart failure patients' degree of debilitation usually necessitates a much slower thing. The typical heart failure program is a 12-week rather than a 6-week program that will be offered by an acute coronary syndrome service. Now, the other important point about heart failure is this is a complex chronic disease which requires ongoing surveillance and monitoring and patient education. The patient involvement in their disease management is crucial here. This is every bit as patient-centered disease as diabetes, for example. The challenge, unlike diabetes, is that test of fluid retention, which is perhaps a glucose equivalent, is not so easy to assess. Patients need to be well educated on how to look for signs of decompensation, signs of fluid retention. They need to be aware of watching their diet, watching their fluid intake. All patients will be recommended to be on some fluid restriction. I would recommend all patients to be weighing themselves on a daily basis. It's a crude tool, but the most cheaply available one we have. 1 litre of fluid equals 1 kilogram of weight, and nobody should gain more than 1 kilogram per day. And if they're doing that, it's fluid retention, and they need to have a strategy of what to do in that situation. Really core to making this whole thing work is that integrated multidisciplinary team. And we're well advised to try and get patients into some kind of a multidisciplinary team setting to get the heart failure well managed. The key members of that team are a heart failure nurse, or a heart failure nurse practitioner, and they're increasingly available both in the private and public sectors around the country. Pharmacists are crucial. These patients are a complicated mix of medications, often with degrees of interactions, and having the pharmacist well informed about medication changes is crucial. Often, particularly in the elderly, Webster pack in these patients is of great value, although I would always recommend keeping some loop diuretic outside the Webster pack for emergencies. Physiotherapists or exercise physiologists are valuable. Exercise improves outcomes in heart failure substantially. When you pull all these things together, this multidisciplinary team together, the reductions in mortality are substantial. 40% reduction in mortality at 6 months with the integration of the whole team. Dietitians are another important person in this space. Dietitians help educate the patients on the salt restrictions, appropriate dietary measures, and once again, how to manage their fluid balance. Patients with heart failure commonly get very thirsty, which makes the whole fluid management much trickier than it should ordinarily be. They struggle with what should usually be a 1.5 litre fluid restriction, and need strategies and tools to avoid that sense of thirst, and dietitians are often good people for that process. They're readily accessible using GP health management plans, and I would routinely recommend that a general practitioner create a health management plan for every heart failure patient to maximise their access to these services. Increasingly, you'll see that these multidisciplinary teams exist in both a private and public space. At this stage, the public hospital system is best suited to this chronic disease management model because of the way the Australian healthcare system is set up. However, more private providers are starting to establish these multidisciplinary teams, and if patients would prefer that, you should definitely enable them access to that and seek out organisations that offer those. The core of these 12-week programs is the exercise program, but also the frequent reiteration by the heart failure nurses who have also been involved in the program about the dietary measures, the lifestyle measures, and answering their questions. It's perhaps often underappreciated by doctors who don't work in multidisciplinary teams, how valuable nurses are in these complex chronic diseases. Patients trust nurses more than almost any other group in the community. And they'll tell them all their deepest, darkest secrets that you as their doctor will just simply never hear. Having a nurse in part of the team is valuable, picking up these things which may be important clues as to why does my patient keep getting sick, why they're not doing what I've asked them for them, what else is going on in their lives that may be impacting their care, which the nurse may find out and you never will. And I rely on that greatly to enhance the quality of the care I can deliver for my patients.